Academic performance enhancing drugs, a revolution in education or an unfair advantage. In Australia, the most commonly abused stimulant among university students is methylphenidate or Ritalin, followed by dexamphetamine, also known as Adderall. These prescription drugs are a stimulant of the central nervous system most commonly used in treating children suffering attention deficit hyperactivity disorder or narcolepsy. So why is medication used by children tended legally becoming such an issue with universities? Between 2004 and 2011, prescriptions for the stimulants methylphenidate and dexamphetamine increased by 300% in Australia. Around 10% of the New South Wales youth population is suffering from impulse control and hyperactivity disorders, needing these medications to allow a regular lifestyle. As children require the medication the most, the unusually high dispensing rate of methylphenidate to those aged 25 and over suggests that a misuse of the drug is occurring. Methylphenidate is in the same classification as ice and cocaine. Recreational users, mostly being university students, ingest low varying doses increasing over time. At around 10 milligrams for $2.50, this supposedly improves alertness, attention span, and cognitive ability of its user, but no official proof for this has been documented. This all sounds great, but needless to say there is always an underlying print. The prescribed doses do not usually cause addiction as they are suited to each patient. So what happens when a non-prescribed user consumes higher doses not synced to their individual body composition? Addiction happens. So how does this work? Inside the striatum within the brain lies a critical reward system. Here, all forms of pleasure are registered through the same process, just on different levels of intensity. When a psychostimulant like methylphenidate or dexamphetamine enters the bloodstream and into the brain, it binds to and blocks monoamines such as the dopamine transporters. Dopamine plays major roles in the pleasure center, motor skills, emotions, and learning. As the transporter can no longer pump dopamine out of the synapses back into the cytosol within the brain, an overflow occurs, resulting in an increased reaction rate between the neurotransmitters and receptors for dopamine within the brain. After an extended length of use, the distribution of monoamine transporters and the messengers controlling the dopamine signaling become extremely unbalanced. With increased brain plasticity from overuse, the user is required to administer a higher dose to achieve the required effect. As the dose increases over time, the user's addiction towards the stimulant increases also. Wanting to get ahead in your study is a great attitude, but using psychostimulants to do so can have some undesirable side effects that only get worse with continued use. With around 1 in 12 students misusing prescription medication as a bid to increase their focus, increasing cases of drug side effects are expected to be seen all over Australia as popularity rises. The overuse of methylphenidate causes side effects very similar to those of the illicit drug methamphetamines, commonly known as ice. These effects vary from suppressed appetite, headaches and nausea, ranging to increased blood pressure, hallucinations, irritability, anxiety, seizures, and in the instance of an overdose, likely death. When trying to study, most students can agree that any of the ailments above would be a bigger distraction than having to study without cognitive enhancers in the first place. Another big issue with non-prescribed stimulants is the creditability of its source. The production of stimulants, let alone any drug, is done by pharmaceutically trained professionals who have adequate knowledge to do so. When drugs are purchased from places other than a chemist or medical professional, the location of its production is unknown. Stimulants are being acquired by misusers and sold back to students in a black market system, being the probable reason to why so many older patients are acquiring stimulants over the counter. When the tablet is not completely comprised of methylphenidate or dexamphetamine, there is likely other chemical substitutes that are easily left unseen. By crushing up the original tablets, cutting it with replacements like bleach and bath salts, then repressing the pills, dealers are able to increase their profit by putting the health of students at further risk. Recent surveys between 2006 and 2011 directed at Australian university students showed that from a student's perspective, the use of cognitive enhancers is a shortcut to studying and cramming information on short notice. While there were those who thought it was used from lack of organisation and not being a true representative of one's grades, others stated it as an opportunistic advantage for a quick fix to keep up the competition among students and to get ahead, maintaining a larger social life. There are many different subjective opinions on the topic of doping for educational purposes, making it difficult to establish a true representation of how many students are using stimulants within Australia as a result. So with unknown amount of students nationwide utilising not so traditional pharmaceutically pumped methods of study, should something be done to even out the playing field with those non-using students? Seen as an unfair advantage, little can be done besides drug screening to prevent students attending under the influence of cognitive enhancers. With the help of non-prescribed stimulants, students are able to expand their social life, catch up at university and maintain a solid grade, but in doing so they jeopardise their health and put themselves at risk of permanent mental and or physical damage. There's much debate on the effectiveness of stimulants as a cognitive enhancer, nevertheless students are still indulging in the drug to maximise their study time. Taking a moment to create planners and schedules allows students more time to study and hopefully avoid consuming non-prescription stimulants. As bringing a notebook into an exam is classified as cheating, should doping yourself with stimulants be as well? With the new generation of young minds, it may be time to update what society regards as legal forms of studying whilst at university within Australia.